Welcome to Madison City Channel's Know Your Candidates interviews, co-sponsored by the League of Women Voters of Dane County. I'm your interviewer, Marilyn Townsend, and I would like to introduce Thad Schumacher, running for State Assembly in District 77. As we begin, I'd like you to give an opening statement as to the educational, vocational, and civic experience you have which qualifies you for this office and why you are running for the State Assembly.
Well, Marilyn, thank you so much for that introduction. And I want to start off by thanking the Dane County League of Women Voters and the Madison City Channel for putting this forum together. So my name is Thad Schumacher, and I'm running for State Assembly, District 77. And I've been a pharmacist for 30 years. The last 10 years, I've taken care of Madisonians across the greater metro area with my pharmacy in Fitchburg. And access to healthcare is something that's very important to me. And so I've always strived to increase access and lower barriers to care during my time owning the pharmacy. I did that by taking mobile vaccine clinics out into the public spaces where there were no pharmacies to give vaccines. I did that when I saw Roe versus Wade overturned by putting Plan B out in the front of the store and selling it at cost because it's important that access is available and barriers are broken down. And I was the first pharmacy to register to provide Narcan through a standing order with the state of Wisconsin. As a member or chair of the Pharmacy Examining Board, I was instrumental in writing new pharmacy rules that expanded services in pharmacies throughout the state of Wisconsin. I want to say that my career I've spent solving problems for the communities I work in. I see it getting harder and harder for people to get the care they need as I see the corporations that run healthcare rip off the American public. And I think it's time to have a progressive healthcare provider in the state assembly that puts the focus back on patients.
Is there any process you believe the Wisconsin legislature should put in place now for redistricting after the next national census?
I definitely do think that we should put in a new process for how we design and draw maps. I think that a good starting point would be the state of Michigan and how they do their process, which is to have no elected officials, no people that are related to elected officials, or no people from the government in a group of people that is nonpartisan. So they have equal number of conservative, equal number of liberal, and equal number of no party. And that group has to come to consensus on a map or choice of maps. And if they can't come to a conclusion, then the state's Supreme Court decides to choose which map is going to go forward. I think it's really important that we take the legislature out of this process.
What issues, if any, do you think could work on effectively in a bipartisan manner in the next session?
Well, when I'm out talking at the doors, I hear about healthcare and how it's really hard to get by. It's hard to get an appointment to go to the doctor. And, being the healthcare candidate, I'm able to talk about those things. And I think that healthcare is something that everyone's affected by, and it's bipartisan. And I think that I'm excited with the new assembly, with the new maps. The assembly is going to be close to 50-50, and it's going to be a different mix of people. And I'm excited to go in there, have conversations about how we can figure out solutions to move forward for people of Wisconsin.
What role, if any, do you think the legislature should have in addressing conditions in Wisconsin's state prisons?
Well, we have too many people incarcerated in the state of Wisconsin, and we need to do more to reduce the number of people incarcerated. Um, I think about the people I interact with at my pharmacy that are uh, outside their post incarceration. And one of the things we do is treat them for mental health issues. And as I talk to them, they tell me about how access to treatment is really the key for them staying out of prison. If they're able to get treatment for their mental health condition, they're able to be productive members of society. They're able to take care of their families. They're able to pay taxes and live a vibrant life. But I think far too often our criminal system uses prison to take care of mental health patients. And I think we need to do a better job of that.
What role do you think the state legislature has in ensuring successful outcomes for all students, including those with disabilities?
Well, every student in the state of Wisconsin deserves a quality education. And we need to work hard to make sure that teachers have the resources and schools have the resources to provide those educations. When I think about students with disabilities, that quickly you go to physical disabilities, but there's all kinds of other disabilities that we need to have in mind when we're thinking about how the school should be run, how class time should be given to students, how extra resources should be given to students to make sure that they have the best shot to a quality education and a successful career post-education.
Are there any steps you believe the legislature should take to further address mental health and substance abuse disorders?
Well, like I had mentioned already, we treat mental health patients at the pharmacy in a wide variety of ways. And unfortunately, our state is at the bottom when it comes to access to mental health care. I've worked with providers in the state that want to be part of the solution, and they want to be part of a system so that they can help people. And they're told by the corporations that run healthcare within the state that, you know what, we have it covered. We don't need more providers. But that's simply not true. And because we don't have enough providers, we don't have enough access. And access, I think, is the key to the solution for mental health crisis. And I think that a lot of times mental health goes hand in hand with substance abuse. And so if we can get increased access for mental health care, I think that's going to have an impact on substance abuse.
What other priorities do you have for your term in office?
Well, one of my big priorities and something that I hear at almost every door that I knock on is the right to reproductive health. So we need to enshrine the right to an abortion in the Wisconsin state constitution. And that's just not abortion, right? It's IVF, it's oral contraceptives, it's emergency contraception. I think back to when Roe versus Wade was overturned, and people were scared. I had young women, I had grandmothers, I had mothers come into the pharmacy and talk to me about emergency contraception. And of course, we had decided to put it out on the shelf, like with everything else in the pharmacy, like not behind the counter, because access to it was key. And I think that even asking someone like me for the product when someone's trying to make a decision about reproductive health is a barrier. And so I think we made sure that it's not behind a lock and key. It's not behind a plastic wall. It's just there, accessible, because it's something that people need right away. And then I think that I also, my oldest child is non-binary, and their wife is a trans woman. And, you know, the way they are treated in society sometimes is heart-wrenching. I deal with many queer and trans folks as I practice pharmacy, and the stories they tell me about their healthcare situations, they're not good. And so these folks are under attack as well. And I think it's important that when we're passing a bill about abortion, we also include bodily autonomy for everyone. And we make it very clear so that no Supreme Court in the future can parse words and say, well, it's this people, but it's not those people. Because when people are able to be the people they want to be, we have a more vibrant community and a better economy.
What would you like to say to the viewing audience as we complete this interview?
So when I was encouraged to run, I found it interesting that there were no healthcare providers in the state assembly on the Democrat side. There are some conservatives on the assembly. And I think that we're at a time and have the opportunity to pass some meaningful progressive legislation like healthcare in the near future. And I think it's important to have a healthcare provider that can tell a story about what it's like to walk through reproductive choices with a patient, or call out partisan attacks on gender affirming care. People need us to work on healthcare because it is not in a good place right now. So I'm excited with the new maps. Like I said, that there's going to be a new group of people in the assembly, and I think that we're going to have to work together to find solutions for the state of Wisconsin. So for 10 years, like I said, I've taken care of the community, and I look forward to being a healthcare provider that speaks on behalf of the patients and the providers, and take on corporations that want to put profit over people. And that's why I'm running, and that's why I'm asking for your vote on August 13th.
I want to thank Thad Schumacher for speaking with us, and thank the viewing audience for taking the time to know your candidates. I want to remind everyone that primary election day is Tuesday, August 13th, and the general election is Tuesday, November 5th. Every election is important. Please vote. On behalf of Madison City Channel and the League of Women Voters of Dane County, I thank you for joining us.